Market to Market is everywhere you are. Subscribe to Market on YouTube, find us on the PBS video app to stream on demand, and add our 3 podcasts on your favorite podcasting app.
Sioux City Police. Sir? Hey, buddy. It's the police department. Can we talk to you?
Studies estimate up to 12% of calls to police, like this one in Sioux City, Iowa,
Hey, buddy, can we talk to you for a second?
are for mental health-related problems.
It's okay if we step in?
Although these Sioux City police officers had some training to help people with suicidal thoughts, many around the nation have little to none.
Can we do that?
These calls can take officers off the streets for hours at a time.
Hey, what's your name, partner?
Both the Sioux City Police Department and Market to Market decided to protect this man's identity.
Police officers and student resource officers that I have talked to have said, this is not our job. We would love to see more training for us and more mental health providers and workers to help us intervene in those situations.
Some city, county, and state governments, including Sioux City, are providing officers with additional training as well as adding mental health professionals to police response teams. In Iowa, every county is now required to have an on-call mental health crisis response team that must be able to arrive on scene within 60 minutes.
I've seen things change rapidly. It's a breath of fresh air to be able to show up to a call and have something like MCAT where there is a mental health professional that's willing to show up.
The teams are often located in the county seat, which can put those who live on the fringes of the county at the outer edge of the 60-minute time limit. If the situation is deemed safe, team members can stay behind, while law enforcement officers move on to other calls.
Our Sac County Sheriff's Department, which patrols all of the Sac County, has 2 officers. This is very similar in every single one of our counties. So you take one of those officers out for, say, to deal with the situation to 4 or 5 hours, it does take somebody off.
Dre, who oversees the mental health team 75 miles to the east in rural Sac County, says the stigma related to mental health is beginning to fade, especially among younger generations.
Having them understand about their mental health, about their feelings, their emotions, and making it okay as a child will then morph into adulthood.
Some experts say even an hour can be too long, especially when it comes to children. The 2021 Iowa Youth Survey of 6th, 8th, and 11th graders found a little more than 20% reported having suicidal thoughts in the previous 12 months, a 60% increase from 5 years earlier.
Our rural people have the same incidence of mental health difficulties as our urban people. The issue that leads to kind of higher suicidality rates in the rural areas is lack of access to services.
Rural areas typically have fewer resources and mental health professionals within a reasonable driving distance. The additional help has been viewed as a positive trend, particularly in light of a nearly 20-year rise in suicide rates that has only seen a limited reversal in the past few years.
I was super excited from the standpoint of it's not just a hospital situation, a hush-hush situation anymore. Like, we're truly trying to help people be successful in their communities instead of being locked up in a unit. I would also say that it's been really difficult, to try to make all these pieces fit, especially in smaller, more rural areas.
Rural communities tend to be closely knit, with mental health support coming via church, social groups, or friends. But access to professional help, even if delivered via video conference, is key.
Some people are more nervous to actually walk into a mental health center and, I don't want to be seen. And so being able to do that by telehealth really kind of gives that mask for them that maybe they want.
In northwest Iowa's Sac County, population 9,700, local authorities say mental health crisis teams have helped, but there is still a shortage of beds for inpatient care.
The state transitioned from the 4 or 5 mental health institutes they had across the state to privatization of the mental health system. So now these hospitals I'm going to call it cherry picking who they take for patients.
McClure says those facing a mental health crisis may instead end up waiting in a rural hospital's emergency room, most of which don't have security guards. When hospital staff feel they are in danger, they call the local sheriff or police, which in turn takes officers away from other calls.
We don't have the resources, we don't have the bed availability, we don't have the manpower, and in some places we don't even have the cell phone coverage to communicate. You can't put a mental health patient in jail. That's not where they belong. These people need help. And I believe the system, for the most part, the total system, is a failure.
In nearby Woodbury County, home of Sioux City, population 82,000, the unit has saved officers an average of 30 minutes per mental health-related call. Officer Duttler, who was a mental health counselor before becoming a police officer, and 3 others responded to this call, where a man was sitting on the windowsill of his multi-story apartment, considering ending his life. The man told Duttler he was upset about a close friend who had killed himself the week before.
No, you're okay, buddy. You don't have to apologize to us at all. You don't have to apologize to us.
Every single human being on any given day is dealing with some level of mental health, and maybe it hasn't elevated to a crisis for you at that point in time, but we're all dealing with life's little quirks and situations, and so bringing the awareness and having the partnerships has brought us a long, long way.
However's good, yeah.
All right.
Thanks, guys.
Yeah, absolutely. Thanks for coming out. Yeah. All right.
You two need anything else?
For Market to Market, I'm Colleen Bradford
all right.
Krantz.
See you later.
If you are thinking about suicide, or if you or someone you know is in emotional crisis, call or text 988 anytime for confidential free crisis support.